Is open rhinoplasty the right choice for my nose? When considering rhinoplasty, many wonder which surgical approach best suits their needs. Open rhinoplasty is a technique that allows surgeons to access the nose more directly, making it ideal for complex cases. In this procedure, a small incision is made across the columella, the tissue between the nostrils. This allows the surgeon to lift the skin and see the underlying bone and cartilage clearly. With this view, they can make precise adjustments to reshape the nose, especially when large, crooked, or asymmetrical deformities are involved. It is also often used when structural support needs to be added with cartilage grafts or when previous rhinoplasty results requiring correction. One of the main benefits of open rhinoplasty is the enhanced control it offers. Surgeons can perform detailed modifications to the nasal framework, which is especially helpful for complex or revision surgeries. This approach makes it easier to reshape the nasal tip, straighten the bridge, or rebuild support structures. Because of the direct visualization, outcomes tend to be more predictable for difficult cases. However, open rhinoplasty does have some considerations. The procedure generally takes longer because of the additional dissection involved. Recovery can also be more extended, with swelling and bruising lasting longer than with other techniques. The small incision on the columella is usually minimal and fades over time, but it may be visible initially. Swelling can persist for many months, sometimes up to 18 months before the final results are visible. There is also a slightly higher risk of internal scarring due to the more extensive tissue manipulation. In contrast, closed rhinoplasty involves incisions only inside the nostrils, leaving no external scars. It often results in a quicker recovery with less swelling and bruising. However, because the surgeon has limited visibility and access, it is generally better suited for minor adjustments or cases where less structural change is needed. Choosing between open and closed rhinoplasty depends on your specific nasal structure, aesthetic goals, and the complexity of your case. If you need significant reshaping, structural support, or correction of previous surgeries, open rhinoplasty might be the better option. For simpler, less invasive changes, closed rhinoplasty can be effective with a faster recovery. Ultimately, the decision should be made after a thorough consultation with a qualified plastic surgeon. They will evaluate your nose's anatomy, discuss your goals, and recommend the best approach to achieve both functional and aesthetic improvements. Remember, every nose is unique, and personalized advice is essential to ensure safe and satisfying results.